if you had the authority, and my God, it would be so cool if it was, if you could make 3 structural changes tomorrow to fix healthcare, where would you start?
For one thing, I divide the question into 2. We have healthcare financing, insurance, which right now is not doing its job. It's taking money out of our pockets and putting it into more concentrated wealth. It plays games. We have to change the financing system. And there's nothing perfect, but I've come to believe that we should have a single health insurance system in the country, a national health insurance. That I don't think the variety of all of these complicated insurance companies and payment systems, I just don't think it's adding value to people. Healthcare is a repair shop. My friend and colleague, Lord Nigel Crisp in England, has written a book, Home is for Health, Hospitals are for Repair. It's because we know a ton about where healthcare, where illnesses come from. And they come from early childhood experiences and education, the way we're educated, and workplace experiences, and elder care, environmental threats, community infrastructures. All of that determines whether we're healthy or not. The way we're doing it right now, it's actually a machine for the transfer of resources from people who have the least to people who have the most. We have over 10% of hospitals are now owned by private equity, and we have very, very good research showing that when private equity takes over a hospital, quality goes down and costs go up. It's taking money out of our pockets and putting it into more concentrated wealth. It plays games. We have to change the financing system. And right now, too much of the thinking is driven by, can I make a buck? No, it's not quite that lethal. I don't think there's a lot of evil people out there doing it, but it's certainly what the signals are.
It's how the system's designed. It's almost like you can't fault the people in the system. It's just how the system's actually designed.
Boy, believe me, this isn't over. The amount of money being made in this Medicare Advantage gaming world is just phenomenal. And it's not going to be easy. It's the most effective way America wastes money on healthcare is with complex administration. There are enormous amounts of wealth being concentrated, and that wealth turns into political pressure in a country that so far allows you to basically buy votes in Congress. Wow. We cannot preserve American competitiveness when we're paying twice as much for healthcare as in any other country on earth, and we're not getting the benefit in terms of the health and longevity of our workers. We just do too much that people don't want. They want peace and company and accompaniment and control of pain and control of shortness of breath, and they want to be home as they approach the ends of their lives.